Hamza is a practicing psychiatry registrar, worked in the NHS and then moved to Sydney, Australia to start his work in psychiatry here.
People are the way that they are for a reason. Well, every individual is completely unique. Their stories are unique. Their traumas are unique. Med school doesn't really give much time to psychiatry. I think people are afraid to do it. They think, I don't want to overstep. I don't want to be seen to be too probing and ask too many personal questions. That's a skill. I did not pay you to say any of that. What psychiatry has shown me is that that's just absolutely categorically not the case. If you truly want to, make friends and deeper connections, the shared experience is literally everything. Like, what is friendship, right? Oh, that's the most controversial question you asked today. That's a whole hour podcast. Generally, people are not nasty people. You control yourself. That's the only thing that you can control is you. And this is like a real subconscious thing, because in the conscious, you're like attacked, right? Your flight and fight mode is up. It's about being 100% present in the moment. I can't dance for shit, but I can do that dance. Yeah. There is absolutely no one-size-fits-all person for anyone. If you're not whole in yourself, then what kind of partner are you going to be? The important thing is for everyone is to know themselves and know what it is that they want. If you can only see the world in black and white, then what about all the shades of grey?
Hamza.
Yes.
How are you, sir?
Very well. How are you?
Great. This is going to get really confusing.
Okay.
That we're both named Hamza.
Yeah. Yeah. I think that's something that we've had to deal with before.
Mate, all right. Let me give a intro, and then you tell me if I butchered it or not. Okay.
Tell me.
So, Hamza is a practicing psychiatry registrar. Worked in the NHS for a few years. Loved it there, and then moved to Sydney, Australia to start his work in psychiatry here, and he's been working here now. Myself and Hamza worked together in a hospital, and he was my senior there, and I fell in love with him there.
Fell in love with me? Oh, wow. Okay.
Is that a fair summation?
The only thing that I'd probably
yes, sir.
Go back to is loving the NHS. I think
loving the NHS.
I think that's something that is probably inaccurate.
Okay.
I don't think I can't say that I love the idea of the NHS, but I think working in it is probably the big reason I left at the end of the day. So the idea of the NHS is great, but working in the NHS as a doctor is less than great, I think, and it's only really gone worse. So that's the only thing I'd probably correct.
Interesting.
In the
fair,
intro.
so I didn't do a too bad job.
Otherwise, spot on. Especially the bit about falling in love. Yeah. I think that was spot on.
All right, well, let's get into it. What got you interested into psychiatry, the study of mental health, that kind of stuff?
Yeah, so it's a story that I'd like to tell people because it's I'd say it's kind of unplanned, but when I look back on things now, it's probably very much the natural progression of my life. Pre-medicine for me, I think I've always had this affinity to talking to people, trying to better understand people. I often joke I was like the agony aunt for my friends growing up, and I'm talking high school days. And so that side of things is very natural for me, but obviously, you get into the grind of medicine, the very kind of analytic, kind of less abstract way of, I guess, how we're taught and how we're kind of programmed to think when it comes to medicine. And so psychiatry never really came into the picture. And unfortunately as well, like where I did medical school in Birmingham, and I think probably not just Birmingham, I think it's across the board in the UK at least, med school doesn't really give much time to psychiatry in terms of, the weeks of clinical experience and things. So for me, it was like, I think we had 5 weeks, and you're attached to a certain team, and that could be a community team, it could be an inpatient. It's luck of the draw, right? Like where you end up for 5 weeks.
Yeah.
I know it's slightly different for different like universities here, but certainly for me that was it. 5 weeks and that's it, and that's all your psychiatry. And so if you have a terrible experience, then you're not going to have the interest. So that was kind of, not that it was a terrible experience. I was probably a terrible student, but I guess going back to the question, like leaving medical school, psychiatry was never in the picture. So you go and you do your for me, foundation training, similar to internship and residency here, and it's general medicine jobs, general surgery jobs, and I trained up in Edinburgh, and I was lucky that in my second year, so residency year, FY2, I was able to, you're allowed to pick your 3 jobs, and in my mind at that point I wanted to do GP. It was kind of the default, because I wasn't in love with any other specialty, particularly coming out of med school in my first year of training. So I chose general practice as a job to do as a resident, which we could do in the UK, and then I did pediatrics and psychiatry. It was actually the other way around, psychiatry and then pediatrics. After doing GP, really hated it. And that was the thing, I was like, in my head, this is what I want to do. And then I did it as a job for 4 months, and I was like, shit, like this is not what I want to do. Okay. And so I was a little bit lost at that point, and I think I just, by the grace of God, whatever luck, whatever you want to call it, I was, then thrust into psychiatry, and this is, a less than adequate job as well. Like, if I was to explain to people what I was expected to do as a resident, like FY2, 2 years post-grad, you'd be shocked. That's cool. And I just remember, like, it being really stressful, but despite that, loving it.
Why?
And, so I think for me, what was huge was, in the times when you're not obviously stressed out of your mind, your opinion about what you were seeing was valued. So, for example, in the general adult ward, I'd be present in ward rounds and reviewing patients, and I was also very present on the ward itself, and got involved in terms of, I guess, talking to patients and getting to know them and their stories. But my observations were really valued in those assessments, and so when you're valued as a team member, like, it just makes the job more pleasant. I think it just makes the experience more pleasant. Whereas I think I always give the example, like, for example, if I was a cardiology junior and I had an opinion on an ECG or on an echo,
they'd be like,
who are you? Sorry, like, on your bike, mate. Yeah. So, you don't feel as valued until you become more senior, and I think there's probably a good reason for it. I think ultimately observations are accessible to all. Like, everyone can make an observation, and it's just there's lots of layers in an observation, and your own stuff, and how you see things and how you perceive things, but that is still valuable, and you can still, an experienced and good psychiatrist and clinician can take that information and surmise it and come up with something useful.
It's funny you mentioned that, because I remember one of the things that I really enjoyed our time working together was like, I remember we would go see a patient or whatever, and then you'd ask me like, oh, what did you think about that? And I was like, just not used to it. Yeah. Because you're still a junior doctor at that 100%. Point. And I was like, why the fuck is he asking me? I don't know.
And so, and I'd like to think that that's come from the consultants who did that with me. And so, yeah, man. So being lost, having done GP, hating it, thinking, God, what am I going to do with my life at this point? To then falling into psychiatry, terrible job. The actual job was awful. And I remember other trainees who'd obviously been doing psychiatry for a bit of time were like, this is not, if this is what you think psychiatry is going to be like, it's not. But when I would say to them, look, I'm actually enjoying this, they'd be like, well, if you can enjoy this, then you're going to love psychiatry overall. Yeah. And so I think at that point I knew that's kind of what I wanted to do. Okay. I went on to do pediatrics next because I was just finishing off my foundation training. Yeah. But at that point I'd made a decision that I wanted to at least get more experience in psychiatry before taking the dive into training, and that's what I did. And as you mentioned, worked for a couple of years locuming around the UK and doing various subspecialties within psychiatry, and I think that really cemented it for me that this is what I want to do. And I can see myself doing as a career. So that's that's what like really got me into it. And I think I can't even remember whether the question was how did you get into it or why do you love it. But
I think you've answered it.
There's so I could probably talk for I probably have talked too much anyway.
No.
But
Talk as long as you want.
more
That's the whole point of
point,
it.
the whole point. Yeah, I think ultimately as a junior getting into it, those were the big kind of
Okay.
factors.
Something I'm interested in about psychiatry, I think, and especially I think I've seen that in yourself, right? Is say for instance you're in the emergency department, you see people at their worst, right? When they're most acutely unwell, most depressed, most anxious, most psychotic. How is it that you would teach someone to take those skills that you've learned there and teach them how to calm down people from an acute moment of stress? So if you're trying to calm someone down who, is a close family member, friend, whatever, what would you tell them? These are the skills or these are the things you should do.
It's funny because this actually has come up, and it's amazing. Like, you get into psychiatry and then everyone around you comes to you with family members, friends who've got issues. And it just goes to show how prevalent it is in our society and how how important it is to kind of be aware and be mindful of your own mental health, but other people's as well. The question that you asked kind of, I guess, touched on a number of presentations. And so each presentation that you talked on would have probably a different approach.
So let's do more acutely anxious, and that could present as anxiety, anger, just someone going really upset, 10 out of 10 upset. How do you calm them down?
Yeah. Not easily. Not easily. And honestly, there's probably not one answer or one approach. And this is going to sound like, a bit wishy-washy, but it kind of is. In my experience, there isn't just one way of doing it, and this is something that I tell everybody as well. Every individual is completely unique. Their stories are unique. Their traumas are unique, and often, if someone's coming to you in the middle of the night into an emergency department, acutely distressed, suicidal, anxious, whatever it might be, something's happened, in their life that's dragged them or caused them to need your support in that moment. And so the big thing is just being present, being empathetic, and listening. And what you find is that a lot of the people that come to you in the hospital haven't had that for whatever reason, growing up maybe, or more recently in their lives. They've just that's what's been missing. And so if you can be that person for them and I like to spend a lot of time with my patients in ED, and I know the managers probably don't like that, and because we unfortunately, society have got to the point of, like, as working in ED, you thought that 4-hour breach and all this, like, I'm sorry, but I understand that there's KPIs and there's money involved, but like the human experience and ultimately outcomes for me drastically improve with the amount of time that you spend with someone. In an acutely distressed situation, just co-regulating with somebody, that's a very kind of...
what does that mean, co-regulating?
Yeah, it's very much because I'm doing child and adolescence like kind of term at the moment, and it's something that you teach, parents to do with their toddlers. But it's a case of essentially being present, but getting the individual to control their breathing, to kind of help them understand what they're feeling, and kind of normalizing it as well for them, and really just validating, what, even if you don't necessarily know the full story, that obviously what's happened has been incredibly distressing, that's led them to this point, and just being really empathetic and doing it in a way that they can feel it, right? Like, I think people are really sensitive and are quite good at knowing when people are genuine and not. So portraying, and I think most of us are pretty genuine in our interactions with our patients, and so doing that, talking them through the breathing process, talking them through their feelings, and just time spent. hopefully brings down that level of acuity.
So it's interesting, right? So I think the way that I've seen how we calm down patients, right? It's very like we're in a position of power and the patient is sort of there to, as in they're more vulnerable in that situation. But say, for instance, a situation where someone is above you in sort of whatever, like seniority, or your boss. Your boss is scolding you or berating you, or a senior is berating you, and they're acutely distressed about something you've done. How is it that you'd calm them down in that situation?
It's a great question. I wonder if it's a question that's coming from our experience.
It has,
yeah,
definitely.
Yeah.
I mean, to give you a quick story, the reason why I'm asking is because, like, my first week of working as an intern, so like fresh out of med school, I didn't know I was at 2 hospitals, and the second hospital I was working at only on the weekends. So the public hospital, I was working at the private during the week. And then I had no idea how the system worked at the public. So I get there, and then there's just a huge job list, and I'm like, I don't know where to start. I didn't even have a login for like the computers.
Yeah.
Finally get it all sorted, and then I go to a ward. I just happen to go to a ward. I didn't even know which wards to be on, right? And then I walk in. As soon as I walk in, the senior nurse comes to me. She's like, "Where the fuck have you been? You're the worst doctor. You're useless." And I'm just like,
Wow.
What?
Yeah.
And I literally was like, no, you don't need to speak to me like that. But like, she was just like, that is disgusting. I can't believe you've been like, where have you been? I was just like, I didn't even know how to handle it. And this was, 2 years ago, first week or whatever I was working. And it was just like, I had no idea how to handle it, how to cope in that situation. So what would you tell young me?
Man, it's a great question, because it's something that I don't think that I have the answer to. Like, I think
you're good at it though.
Yeah, I think when you're put in the situation, which lucky, I'd say I'm lucky. I've not been in that situation very often. Just again, I think it's really hard to do in the moment, and me saying it now in this situation, looking back and having the kind of the hindsight, kind of 2020 vision, realizing or understanding that person, generally people are not nasty people, particularly in healthcare. I think if we can meet at that level, like we know that by and large, 99% of people who work in healthcare are good people.
Sure.
Right? If we can meet at that, just hear me out, right?
Sure.
By and large.
Yeah.
And not nasty. And generally, like even in the general public, what percentage of people are like nasty people? It's going to be a small percentage. So we can sort of start there and then sort of say, okay, this person who's berating me at the moment must be berating me for a reason, i.e., have they had a shocking day? Have they just had something happen to them? And they're sort of taking it out on you, which is honestly probably most of the time, right? Like they've not eaten, they're stressed. They've not had their afternoon coffee, whatever it might be. There's a bunch of reasons why people will behave in that way. And if you can have that element just sitting there in the back of your mind that this person's not a bad person, they're probably stressed themselves, which is why they're sort of talking to me this way. And this is like a real subconscious thing, because in the conscious you're like attacked, right? Your flight and fight mode is just up, and you're ready to sort of like probably bite back or go into your own sort of defenses. But if you can train yourself to just have that going on in the back of your mind, then your response just naturally becomes softer. And I think when you can meet, often we say when people are escalating, you control yourself. That's the only thing that you can control is you. So the way that you speak, the way that your tone of language, and what words that you use, your body language, then that can really just puts a blanket over a situation, like a wet blanket. And I was going to give an example of something that happened recently where I was actually it was at a dinner party. Weirdly enough, it wasn't even in a work situation, but work people were there, and a controversial topic came up. Let's just say, I always like to I think there was one individual had a really strong opinion about this situation, and I don't know a great deal about the situation.
Yeah,
and there was let's say, a kind of a bit of information objectively that was presented, and I just sort of based, like, the question was about that thing, that one thing, and I'll just say, it's a text message, say, for example, and so let me read it, and I'll form my own opinion about how messed up this thing is. I didn't see anything particularly wrong with the thing, but there's obviously like a whole history behind. Okay. And so, like, I just very much, like, I just gently offered that I didn't see too much wrong with the message, sort of thing. And then there was this, like, kind of
flurry.
Like, how could you say that? Like, blah, blah, blah. And I just sort of, I was like, kind of, oh gosh, someone attacks you, you can start to feel that burning sensation inside.
Absolutely.
And I'm like, okay. Because obviously, like, the way that was communicated was in a pretty rude way, let's be honest, which I didn't particularly, appreciate. So my response, in order not to escalate the situation further, was, again, just really contained. And I noticed that in myself. I'm like, and I guess in those, like, I wouldn't be like this at home, like with my wife, for example, and she'll tell you,
upfront.
I'll be like, and kind of just. So I'm not trying to say that I'm like some sort of immune to, getting angry or emotional, but in that situation, it's almost like a tool to be able to do it. Because can you imagine, like, if I had, I think if I responded as I would maybe with my wife or a family member or parents. In that situation, then the whole evening would be ruined. Like, do you know what I mean? It would have turned into a whole thing.
Yeah.
And so just by calming my tone, being quite matter-of-fact about why I'm saying what I'm saying, and sort of explaining things to a pretty heightened individual at that point, it just kind of calmed the situation. And then and often just being a bit funny at the end, or trying to be, helps too. Just
humor.
Like humor kills the whole thing. Yeah, kills the whole situation.
So I guess
well timed.
How though would someone? Because it seems like you're able to control your emotions, but for someone who feels like they can't, like, what is it, for example, you're telling yourself in that moment? Because I remember we talked about this before, but essentially sometimes as a male, when you feel attacked, you get this ego, like, I have to fight back now. And we discussed how being in a more submissive position can actually be a better position. So if someone, tries to start a fight with you or whatever, walking away from that is, I think we can all agree that's a better thing, because then you don't risk, dying or getting injured or whatever.
Yeah.
But it's seen as a submissive thing.
Yeah,
right?
yeah.
How do you interpret that in your head when that's happening?
So the situation that I described, yeah, we've talked about this, like the going down to go up, one down to go one up sort of situation. And yeah, as you said, I think males, for whatever reason, I think biologically, personality-wise, struggle probably more with that. What do I tell myself? I don't think there's any sort of real conscious thought process that goes there. It's something that's probably learned over time, over years of just doing it. Being put in a position often of needing to do that with patients as well, like because we meet so many, unfortunately, can be kind of aggressive or challenging patients behaviorally. It becomes a tool, and all of these things, regulating your emotions and even the way that you talk in certain situations is learned behaviors, right? Like you can literally, if you think of your brain as a muscle, you can train it, and it can learn, and it becomes a reflex. So I don't believe that there's a conscious thought process that goes through my head.
Is there something that you might say, for example, like, let's just say I'm someone, like a friend, right? And I'm like, Hamza, I can't believe you said that. That was disgusting. Like, that is so horrible. You're such a shit person for that. How would you respond to that?
All the time. So my default position, and look, and I'm probably, probably not the space to go into the whole kind of, like, I guess everybody has their psychodynamic, like, defenses as well. my go-to, and again, there'll be reasons for this in my early development that I don't know necessarily at this point, and everybody has their own reasons. But my default position is always to take the blame, like it's probably been my fault in some way, and that's really like a very submissive position. But I guess I've learned over the years that that's the position that is less likely to escalate a situation, and I'm very conflict avoidant as a person. So if somebody comes to me and says, that was a really shitty thing to do, blah, 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 then I'll be like, yeah, probably, I'm sorry. Like, that kind of thing, rather than, I guess I don't have that huge sort of, I guess in some ways, narcissistic defense of I'm always right, or I'm probably not it probably wasn't my fault, it's probably your fault. And in some cases, it may well have been the other person's fault. And on reflection, after I've already sort of said, okay, I'll probably go back and think, yeah, but you know what, it probably wasn't my fault in that situation. And you know what, at certain times you can go back to that person, depending on who it is, and actually talk about it when the emotions are a bit
calming down.
Completely.
Agreed.
And things, the outcomes are always a bit better, I think, rather than like getting into this emotionally fueled argument. When you're both calmer, that individual's more likely to actually also kind of meet you somewhere in the middle, if not, depending on what the situation is, if not take the blame entirely. But yeah, my default's always, I think, like, even if it's a 50-50 situation, I err on the side of it was probably my fault in some way.
That's interesting, because I think for most people that's not the case. I think for most people, and I think I'm probably in this bucket as well, is my immediate instinct is, no, I'm not wrong. I'm not wrong. And then it's like a defensive, like, push away. And then later, when I'm calm, I'll think, maybe it was my fault.
I was in the wrong in that situation, yeah, like again, there's examples that I can think of even now.
How has your work changed your view on life?
Yeah, that's a great question. Jesus, that's a whole hour podcast in itself. How has it changed my view on life?
Yes,
man. I think psychiatry has definitely opened my eyes to what the human experience is, more so than from before. Like, everybody growing up has a set of belief systems or values that has been instilled in them, whether that be religious, cultural, whatever it might be.
Yeah.
But your parents and their parents and the wider community, your family network, you have a way of thinking and that way of thinking helps you understand or form your view of the world in some way. And for me, that was, growing up in a Muslim family, having that religious background and upbringing, which is still present to this day. But I think that psychiatry has really kind of opened my eyes to other viewpoints and ways of seeing the world that have shown me really that that different people see things completely differently, and through no fault of their own have these kind of opinions or have these ways of looking at life. And I think, unfortunately, the way that society has gone or is going at the moment, narratives are such a big thing, and seeing things in certain ways, we're very much now grouped, and there's one or two opposing sides. But what psychiatry has shown me is that that's just absolutely categorically not the case. This sort of partisanship of right and left, and you're this way or you're that way. If you're not with me, then you're with them. It's a really unfortunate, I think, just from a kind of a human experience point of view, nothing more, right? Like, if you can only see the world in black and white, then what about all the shades of grey? Like, there's so much value and so much nuance to everything and everyone. To just discount it all is a shame, I think. And so, the people that you talk to, when you get to hear people's stories, their upbringings, how they were parented, and beyond, like generations, like the kind of all of that stuff, you really get more of a sense of why people tick the way that they do, and that tells you a lot, really. Like, I think there's again certain narratives around politics and other things like that. You start to realize that, again, people think that way for a reason. It's not because they're bad people necessarily. Like I said to you, there's very few people who are just bad people. The people are the way that they are for various reasons, and that's not to say like that justifies doing bad things. Like, but you can, I think, often separate behaviors from the person. It's like a classic example of someone's sort of stealing. Like, it's obviously a bad thing to do, but like if they're feeding a starving family, it's an important bit of the story.
Absolutely. So it's context.
Context, yeah. And so I guess psychiatry gives you context to people.
Interesting.
Yeah.
Very, very. I actually really like that.
Yeah.
I think I learned that as well when I did my psych rotation, was like some of the people who I thought would be like very scary or intimidating, when you speak to them, they have very similar fears as you.
100%. Yeah.
And it's like, whoa.
Yeah.
Like, how does this person fear, their dad not liking them or whatever?
I'm glad you brought that up, actually, because that's one of the things that I think I've learned probably more recently is how bloody similar we are to our patients. And my approach, and you've probably seen this, is like I talk to my patients, and not in an unprofessional way. I think there's always having a boundary and a frame is hugely important. But I talk to them as I'm kind of talking to you in some ways now. Like if we just put microphones in front of us and we just talk, then the content that you can get from people, but like the history and all the assessments and blah blah, what we try to do, the quality of that is so much better. And I fear and I feel that unfortunately, for whatever reason, and maybe because psychiatrists are now, like, obviously we're doctors, and the way that we're taught and trained, unfortunately, is very, like, again, analytical, and it's this kind of set way of taking histories, and it's very kind of regimented. I don't. My personal view on that is I don't think that that's a good quality way of doing it in terms of the experience, but also what you can get from someone.
This led on to one of my questions later down the track, but I think I'll bring it up now, is something, I've told you this a million times, say it publicly now, I'm sure, is, when I worked with you, I thought you were just very excellent at interviewing patients. And there was something about your softness, but also it was like a human professionalism. I don't know if that makes sense. So it's like you said, you establish a boundary, but you also are there as a human, and you make this, like, the patients felt safe in the conversations, and you open them up, is what I mean to say. So I think I'm just trying to learn how to apply that skill to people in their everyday life. Say if someone is trying to get to know their parents better, or if they're trying to make more friends, how do they open people up more? What are some things that they could use that would be helpful?
That's a great question. Firstly, I wanted to just thank you and just let everyone know that I did not pay you to say any of that.
Oh my God, no, wait. Can I tell a quick story?
Yeah.
we were at a New Year's Eve event, and then Hamza's wife was there with his sister, and I was saying to Hamza, I was like, Hamza, you're one of the best, doctors I work with. You just have such a good interview technique. And he's like, I want you to repeat exactly what you just said and say it to my wife.
Yeah, she does not. I'm sure she does not see any of that. And I just wish you could be my supervisor as well. Just write this stuff down. No, but I do appreciate that. And actually, and I'll say this publicly too, that I've always said that I think that it's a I don't know. Obviously, we can't predict the future, but I feel like you have that knack, and it can be learned. I'm not saying that I'm some special dude that just fell out of the sky and can do this. It can be learned, but certain people have an affinity to it, and I think you have that. And I think I've always said this. It's a shame. It would be a shame. I won't say it is because I don't think it's definite, but it would be a shame if you didn't pursue this career. And I'll keep trying to recruit you. I will
into psychiatry.
Into recruiting and two Hamzas in the same room probably. Yeah, no,
Thank you.
I truly mean that. But to answer your question about how do you open people up, again, like I don't know that I have the answer to that. But what I can do is reflect, I guess, on my own experiences and I guess what I think that I do. And for me, it's about being 100% present in the moment. And and it sounds obvious, but like I've been in assessments and I've seen assessments where I feel that the clinician on the other end is not paying attention or is not fully present, is not fully engaged. And whether that be eye contact, whether that be non-verbal cues, whether that just be picking on certain threads of a conversation and just very naturally letting the conversation flow and not being bogged down by, but I didn't ask them about, like, I didn't ask them how many hours of sleep they got, right? Not being bogged down by all that. Because we're good enough to know, like, that stuff needs to be checked off at some point. But that's, like, the mundane, you know? Not saying it's not relevant. It's completely relevant.
Yeah.
But to get someone to open up, and I guess, you know, you broaden that out to sort of just your family members and dad and things like that. I think it applies. Being present and not being on your phone. Like I've seen that in assessments, phones going off, texts going, and people are busy. Like consultants are on call. Don't get me wrong. It's not me saying that they're awful for doing it, but it makes a difference for the patient when you're kind of one eye on, you know, the WhatsApp's messages coming on you. You know, it just makes a difference. And it's unfortunately some things that, like, in a clinical setting, are just unavoidable, you know. But you will notice a difference between an assessment that was interrupted versus one that you were fully engaged in, and it's being completely available to that person. And again, for that individual, it might be because when they were growing up, their parents were not as available for whatever reason, and you then becoming that object to that available parental figure in that 1 hour. And again, for me, time spent is a big thing too. Like 20 minutes, 10 minutes, it's not enough. Right. And I often go into, like, when I'm on call, like, I'm expected to do like a 10-minute review. It's never a 10-minute review. And what's a 10-minute review? Like, I need to make a connection with the person. Otherwise, I don't feel like I've done my job, or I haven't done the thing that I was set out to do. And with parents or family members, again, a bit trickier because the dynamics are completely different when it's a parent or friend versus a patient. Completely different set of dynamics. But again, I think the core essence of being present and completely available is the big thing.
I love that.
Yeah,
I love that.
And by the way, disclaimer: I'm always on my phone. Like, I need to learn. I need to listen to this myself, because my wife will tell you, she tries to talk to me and I'm on my phone, like not
watching
present.
The Liverpool match,
or something on Instagram, some other. Watching your YouTube channel.
Oh, mate, thank you. Okay. Something I notice about you is that wherever you go, you always seem to have friends. And I guess what would be some tips for people struggling to make friends in various different realms? How could they gain more friends? And what are some tips you use when meeting new people? So I think that sort of ties in with the last point where being present with them, definitely. I agree.
Yeah.
Could you add on to that?
So fun. My wife was... asking, or we had this conversation, I literally think yesterday or the day before, and it's not a brag, but like I don't like I don't like that you said that, like that. I find it easy to make friends.
But I think it's true, and I think that's one of your like, everyone has different things that they're just really good at. Like they're sort of not world class, but I would say that that's sort of their calling. And I think one of your callings is that you can connect with people. And I'd like to think I can too.
Yeah.
But that's why I was drawn to you, because I think you're even better at it.
Yeah. Again, I don't like the statement better. I don't think.
Yeah.
Again,
Well, someone I learned from.
Yeah. No, I agree with you. I think that's why I think you would make a great psychiatrist. You know, there's a natural affinity to, and so going back to the conversation I had with my wife, because she, I think, would say that she maybe struggles on that end, and I think that's where the conversation came up. Actually, in many ways, with the question that you asked, and I think I was pondering on it. I was like, I don't particularly think I do anything special, but the thing that I guess it boiled down to for me was being inquisitive, right? Like I was in a situation again recently where I was in a group of guys who, a couple of them I'd never met before, knew about but never met face to face, and so not being afraid to ask questions and really get to know someone or be inquisitive about someone, right? Like, I'm interested in you. Like, you are here, we are here together, and I am interested in you. Tell me about yourself, right? Yeah. And doing that, and being not afraid. I think people are afraid to do it, and I think because I think people are afraid because I think they think, oh, I don't want to overstep. I don't want to be, seen to be too probing and ask too many personal questions. That's a skill. I probably do overstep at times. I'd like to think that I've got to a point where I don't do it very often because I kind of know, okay, this is probably a question that's a bit too personal. Yeah. And you can gauge an individual too, whether they will find that question too personal or not, right? Like, I think you probably found out very, very quickly that I don't really find any question too personal. But there are people that might be a bit more guarded, and there'll be reasons for that, right? So again, we go back to the very first thing we talked about, like, people are the way that they are for a reason, and so if they're a bit more guarded about something, this is probably a reason for it, and you just leave it alone, right? And it's about being sensitive to the person that's in front of you, right? Their responses, how their body language changes.
It's like a dance.
It's a beautiful dance. It really is. I can't dance for shit, but I can do that dance. Yeah. And so the other day, like, two new guys completely to me. And I had a genuine enjoyment from the experience of getting to know someone. Yes. And I think that comes through. How it comes through, maybe a third person observing could tell me. But point is that there's certain things that happen that you can tell that the individual is actually enjoying this experience. And everybody likes the spotlight on them for a bit, right? Everyone likes to be the center of attention for a little bit in a non-confronting way. Like, not everybody likes to be under the lights on this camera. But in that situation, like, being seen to be interesting and someone be interested in you in a meaningful way is huge. And so that's when people then you create a really positive experience and connection. And so I guess people want to be friends with you, because they liked that experience with you. And life is just shared experiences, like a bunch of shared experiences, right?
Absolutely. So what would you say to someone who doesn't find themselves inquisitive about people? Because I think as you were saying that, what I was thinking was maybe when I was a lot younger, I wasn't that, like, I was more just like, when I'd see people, I'd be like, oh, well, like, whatever. But now I think I changed that when now I ask myself, what can I learn from this person? And then I go into these situations just to be like, even if I'm stuck with someone, I don't really like them, whatever. I remember there was someone in med school who I didn't really get along with, but I think I was just stuck with them for whatever, like a class or something. And I remember I had to speak to them. I was like, okay, what can I just learn from this person? Yeah, and so, like, that line of thought helped me think, like, be more inquisitive, even to a person that I don't really enjoy speaking to. And I think that's what's helped me in these sort of situations. I don't know if that's what works for you as well.
I have to say, this never occurred to me to sort of, like, go into that a situation and what can I learn from this person? But actually, that's exactly what's happening. Just thinking back to the example that I gave, like, that was what was happening. Like, I guess that's one way of being inquisitive is to learn about or learn from that person. Like, everybody, I believe, I truly do, that everybody has something to offer.
Definitely. Yeah.
Whatever level that might be, they've got something to offer, whether it be a professional level or just, in terms of life experience. Everyone's got something that you don't.
And how do you find it?
Yeah.
What can they tell you?
And I don't mean that in a way of like, I'm necessarily going to use that information to do anything with, like, or try and like implement it in my life in some way. I don't necessarily mean that, but I think that, again, sometimes just the process, I think, is everything. There doesn't need to be the means is enough. There doesn't need to be the end as well in what we're talking about. For me, there's just an enjoyment factor in that process that I thoroughly like. There's something I get a kick out of it. I don't know what it is. There's something I enjoy, and where that comes from, I do not know. I think my dad is like that, and I grew up with that. He is somebody who very similarly finds it quite easy to make friends and has many friends, and is respected, in his community and out his workplace. And so I guess I'm subconsciously aspiring to that, like as my dad. But I think I guess I've probably picked up things from him that I don't even know about.
Leading on from that point, what do you think are the best qualities you got from your dad?
So good. I mean, it's a great question. I always say this, and it's probably really corny to say, but my dad is for me the best person I know. And I feel privileged that I can say that I've got a father that, has imprinted or left that in me, that I have that feeling towards him. The best quality, did you say best qualities? Or
the best quality you think you got from him.
I think I would say his patience. Yeah.
Tell me more.
I think my dad worked on himself, and I think that's maybe the second or close to the first thing is his desire for self-improvement, constant. It's something that he instilled in me and my siblings from very early. The ability to self-reflect, I think I get from him, which is such a core skill in psychiatry. He's just doing it. From naturally, he's not a psychiatrist. Like he just that's it. That's what he does. I think he gets that from his religion. I think that he gets that from our religion. And so that self-reflection and that kind of humility to be in the wrong and that be okay, it comes from him for me. That kind of moved away from patience because I'm now thinking of all these other things that the qualities that he's probably given me. And humility, being humble is something that he drove home so hard. Like arrogance for him is like the worst quality and the worst trait that a human being can have. And so, and not to say that at times I don't demonstrate that, but I know that I have to check myself. But then going back to sort of the patience side of things, and he being a doctor himself, but an anaesthetist has had to overcome lots of different issues, and I think even in his circles and stuff like that, patience has always been is a big trait of his that I admire. But I'm actually going to change the answer and say that self-improvement, self-reflection elements, like I've seen him change like in front of my eyes. He wasn't always patient. So that's that, but that comes from the self-reflection and self-improvement. So
that's incredible, because I think that part of myself as well, the part that's always wanting to learn and improve myself, I do see that from my dad as well. And it's so funny that you said my dad is the best man I know, because I was in the car with my brother the other day and he literally said that to me. He was like, I think our dad is the best man I know. And it literally made me like almost tear up.
No, I get emotional talking about it.
And I was like, holy shit, like that's so true. And I think it's crazy. And we're blessed.
Yeah, absolutely. And this is the thing. Like I guess it goes back to what we've been talking about throughout this, is that we're blessed, we're privileged, we really are, because unfortunately not everybody's in that position. And so we see the world, and this goes back to how psychiatry has changed the way that I see the world. we see the world through a lens of having such a incredible parental stability and figures. We've talked about our fathers, but come on, man, like mums. I could speak for my own mother. Just an incredible lady who sacrificed so much of herself for a family. We see the world through that lens.
Yeah.
People don't. Like,
No, everyone has that.
I don't even know how many. Like, we may be in the very privileged few. I don't know. I really don't know what the answer is. But where we can see things like we can see the world the way we do because of really the privilege that we have. But people who maybe don't see the world that way for a reason. So I think that just it's an important thing to just remember and I guess humble ourselves as well about.
What would your younger self not believe about your life today?
Wow, where do I start? Jeez.
Top of the list.
Living in Australia? I think that'd probably be number one, and then that's number one. Living in Australia, never. My younger self, no chance. Australia seemed like a different planet. Like, how do you even get to Australia? Who would travel? Who would fly 24 hours in a plane to go somewhere?
My God.
Yeah, no chance. There's no way. And obviously, as I got older, it became more of a possibility. But my younger self, living in Australia, no chance. I didn't even think I'd probably ever go to Australia.
Really?
Well, my best friend, his entire extended family are here. I remember him visiting when we were young, and I remember the pictures and thinking, this is an incredible place. Like,
Best city in the world, mate.
Sydney?
Yeah.
Yes. Second to Manchester, maybe. But.
No. Well, I've never been, so...
No, definitely not. Like, that's my bias talking. Home to the greatest football team, but we won't take it
Western
down
Sydney Wanderers.
I mean, I'm wearing the wrong colours, but Manchester United Football Club, of course, yeah.
Oh, that's right. I called you a Liverpool fan before, didn't I?
Yes,
Was that a bit of a dig?
Biggest insult you could give a
Love
United
it.
fan, yeah.
Good. What would you do if your son was a Liverpool fan?
Oh, that's the most controversial question you asked today.
Disowned.
No, it can be whatever it wants to be.
Okay, so speaking about your son, if you had a very shy son...
A very shy son, yeah.
Very shy.
Okay.
Introverted. How would you teach him how to be a better speaker?
I don't think I'm a very good speaker.
I think you're above average.
Above average?
Yeah. So I think you're good.
Do you mean public speaking?
In everyday communication, workplace, friends, this.
Just do it. Just do more of it. That's the only way. My baseline is that anxious. Like, I have an anxious personality. And so exposure is everything for me. Like, so the more I do something, the just more relaxed I am about it, the bigger my more my confidence builds and all that kind of thing. So I think just doing and not avoiding, because I think with anxiety naturally comes avoidance. And when you avoid and you're anxious, it blows up. So the classic kind of, making a mountain out of a molehill situation.
What if he's got an interview tomorrow? He hasn't had time to practice. What are the top 3 or 5 things you're telling him, do this to make yourself look like a better speaker?
Eye contact. Breathe. Like, breathe before, during, like, just make sure you're breathing and just slow yourself down.
Okay.
I think the thing that people who get anxious do the most of is just talk quick and talk endlessly. Pauses are fine. Like, that's really hard in the moment to feel. Again, something that you learn when you interview patients and whatever. Like, you silence is okay, and sitting with that is okay. People feel like they need to fill every silence.
Yeah.
Like, I can sit with a patient for like a whole minute. Like, it's hard, but like a whole minute and not say anything.
I remember being in the room when that happened, and I found it interesting. Yeah,
You can learn a lot.
Yeah.
And you can learn a lot about what they then either bring up or don't, or whether they walk out or whether they stay. Just being there, just being present again. But yeah, just silence is fine. Pause. I wouldn't sit there for a minute in an interview and not say anything. But, but take your time. Like you can have pauses.
When was the last time you felt genuine happiness?
That's a really interesting question. How would you define like genuine happiness?
Whatever that means to you.
Yeah.
Like,
Okay. Yeah.
Do you want me to give you an example and maybe that'll help you?
Yeah. Yeah.
Okay. I think it was like my nephew was doing something really silly. Oh yeah, that's right. He saw a reflection of himself in the like on the fridge, and then he was like trying to kiss the reflection.
So sweet. Yeah.
I just started laughing because I thought it was so weird.
Yeah,
I was like, why are you kissing yourself? And then it just made me laugh, and I think that was a moment of genuine happiness for me.
That's so interesting because I feel like I feel genuine happiness all the time. Like this almost sounds like a ridiculous answer. Like every day I wake up, I'm genuinely happy. It's not. I don't feel like I'm. It's like a manufactured happiness, but maybe what you're asking is like an exceptionally kind of
like a moment where you like. That was a moment that I'll remember that I was really happy in. And the last time that happened.
The last time that happened. So, I think it was in my when we recently went away. So I don't know, that went. We were in the Amalfi Coast for a few days and back in England as well for a few days. So it's not one moment, but so there were sort of, I guess, two moments, if you like. There's a group of friends that I grew up with. We got together, and that whole experience with them on the Amalfi Coast, with the beautiful backdrop, with great company, people that I've known my whole life, beautiful, with my wife, and their wives now and stuff like that. It was just, it was beautiful. And then back in England, because I was there for a wedding, I was the best man for my best friend, and who was also in the coast. So that whole experience, being his best man, seeing him get married, and having my whole family and his family, like that whole experience was amazing as well. Like again, emotional, like just really, really nice. Yeah.
I love that.
Yeah.
As we're talking about this, I was just thinking in terms of like, how you were saying how we're both very blessed. We have a very good group of friends, good family. How would someone who doesn't have that start? If they feel like I don't have any of this, because I feel like at certain points in my life, I was like, I don't have a really close friend, or I don't have as good of a relationship with my family as I want to. And I think that took time, and I think it can get really demotivating when you're at that point. So how would you say to that person, from my experience, start like this?
So the friends that I've talked about, like I was again just lucky, man, because they were family friends. Like they were my dad, like our parents are friends, and then so they had kids, and we became friends, and it just kind of grew together. So it's like a brother sister relationship with them. But I feel like I've made really good friends outside of that as well, and I definitely have. The guys that I went to med school with or university with. Like we're really close, and what it was just. I mean, some like there's a lot of stories there, but which are probably not fit for podcasts, but shared experiences, and I'd say like put yourself out there, like get yourself out of your comfort zone with people, like. You don't know them well at the moment, and so it does feel uncomfortable to go on a trip with this person or these people. Just do it. If you truly want to, make friends and deeper connections, my view is that the shared experience that you have and the memories that you create is literally everything. Like, what is friendship, right? It's like, yes, you obviously you have to meet. It's like almost when you find a partner, right? Like you have to at least meet at a certain level of superficiality of like, oh, you like the same things or some of the same things that you can talk about and bond over or connect over at that level. But then beyond that, it's just like spending time together and doing things together that builds the memories and it builds the bond. And I think if you were setting out and you felt that you hadn't made those connections up until this point in your life, then I think just putting yourself out there, knowing what you like, don't kind of feel that you need to be somebody that you're not around different people to do that. You will find your people. Like, you know, there's someone for everyone, not just from a partner perspective, but friends as well. There's like, know what your interests are, look around that kind of circle and put yourself out there and just kind of, it will be uncomfortable to begin with, but I can almost guarantee that if you keep going or keep doing things with these people, you'll feel that deeper connection eventually. It comes with time.
It reminds me of I was reading this book by this guy called Jay Shetty. It's called 8 Rules of Love. Yeah. There was a quote in it which essentially said something like, you can go your whole life looking for love, or you can start experiencing love now by giving it. And I thought that was really sort of relevant to what you were just saying, was like, I found my connections in my life deepened when I actively was like, how do I show more love in this relationship, right? Even for like, you know, just an acquaintance being like, maybe something simple like, oh, hey, let me get your coffee this time. You can get it next time. Something like that. That's an act of love, right? And there's different sort of levels or tiers to that, right? But I thought that was a good sort of point to.
So when I pay for your coffee and you make it like, you're like, no, I have to pay you back. I'm like, no, you don't. Like even today, you're like, bring 2 bottles of water, I will pay you back. I was laughing because my wife was in the car and I'm like, did this guy really ask? Like, did he really say, I'll pay you back for these 2 bottles of water?
Hey, man, water's expensive these days,
brother. What is wrong with you, bro? If I buy you a bottle of water, I'm not taking money for it. What's wrong with you? But yeah, no, I totally agree, man. Those acts of love, that's a huge way of expressing things. Like, I really enjoy getting gifts for people and things like that. Like, I think that's, especially when it's meaningful, like, I think it's a way of showing that you care. Like that you sort of see the person, that you know who they are, and that you care about them. I think so. Those things are amazing. Yeah.
Inversely, so we've spoken a lot about how to be with people that we're close with and we love. How do you deal with people who are like emotionally manipulative, or people who, not that they're malicious, but that you just want to set a boundary with them, like a healthy boundary, and you don't really want to associate too much with them? How do you do that from a psychiatric point of view?
People who are like that, I hope this doesn't sound too repetitive, but like people who are like that for a reason. And often, these are all defense mechanisms to protect themselves emotionally and intrapsychically, protect themselves. And so they may not have ever experienced healthy relationships before, these people who are a bit manipulative. That's what they learned. That's what the behaviors that they saw in their own house or around them. People who are unpleasant or aggressive or whatever it might be, they've possibly learned that, or they've generated that through their own defenses. I think if you can, and it's not always possible, and we also need to learn when we can't do something. Like, I think medics, doctors, psychiatrists don't always know when they can't help. There are people you can't help, unfortunately. I won't digress too much on that point because I think it is a whole other topic. But with individuals that you're describing, I think if you can, showing them that there are healthy relationships, that you can have healthy relationships, and if you're that good person in their life that can be there in a healthy way, be that person, but don't destroy your own mental health or whatever, like your own, happiness in doing so. And therefore, again, if you can, creating boundaries in topics of discussion or things that you don't want to engage in, and being very clear about it is really healthy.
What's an example of, like, say, a sentence someone could say for if they're trying to say or establish a boundary with someone? Say someone's inquiring about something that you don't want to talk about,
Hmm.
what would you say in response to that to establish a healthy boundary? Because you want to sort of do it in a non-confrontational way as well, right?
Something like, hey, I know, I understand that you really would like to know this about me, or you'd like to do this, or whatever it might be. I really understand that that's something that you like to do, but I just don't feel very comfortable or okay with that. And almost leave it there and see, like, you can gauge their response and go from there. But that's kind of how I would approach it. Like, I acknowledge that it's not unreasonable, like it's not outrageous, but you don't feel uncomfortable. You don't feel comfortable about that or that situation. And it might just be because of that individual, and that person is a bit whatever. It may not be that, it wouldn't maybe there'd be that confronting with somebody different. That's how I would approach it. Yeah, like, I understand, but this is, like, I just don't feel good about it, or this is why I don't feel good about it. And I often think that providing explanations is respectful. No, maybe not explanations, it's the wrong way of putting it, but I like to give people my reasoning. I think that's respectful. I think like, you've got an intelligent person in front of you who thinks, explain to them your thinking. Maybe they'll get it, or maybe they won't. And that's fine too. But I think you a lot of the time people will just understand if you give a good enough explanation or reasoning about why you're saying or doing what you're doing. Yeah.
I think the sentence there was a good one. I think it's short and sweet.
Yeah.
But it's also non-confrontational, which I think is what people need. And I think in moments like that, it's a bit hard sometimes if you haven't, like, for me, I like to just pre-prepare, like, this is what I'm going to say. And I would say something like that. Like, just because in that moment you're acutely stressed.
Stress,
and you can't
man.
think
It's
properly.
a horrible position to be in.
Yeah.
And again, like, I'm definitely very conflict avoidant. So I really don't like being in those situations. But
Interesting. From a psychiatric point of view, how do you find a good partner?
From a psychiatric point of view.
Yes, sir.
What does that even mean?
Yes, sir.
Man, God, I don't know that there's an answer to this, because it's such a dance between two people. Like, I stole your word dance because I really liked it. But there is absolutely no one size fits all person for anyone. Different people need different things from their partner, whether that be emotional, sort of physical, practical, status, blah, blah. There's so many different domains and components, religious, cultural, blah, 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 blah. The list goes on. I think the important thing is for everyone is to know themselves and know what it is that they want from this life partner. And you should always, who doesn't, go into that with the idea that, like, when you're picking someone as a life partner, you're going to be with them forever. So forever's a long time. And that finality sort of needs to resonate when you're sort of making that call or making those decisions. And look, you're never going to be 100% sure, and nobody knows everybody 100%, right? But you know certain objective facts, which either you can or cannot tolerate. And when you spend time with an individual, you get to know about their personality traits. And if they provide you with the things that you're seeking, and if you feel emotionally connected, and if you feel physically connected and all those things, then that's, what more could you want, right? Like, that's kind of what you aim for, I guess. It's easier said than done, of course. But knowing yourself is the first thing. If you don't know yourself, then you're going to be led on a merry chase. I guess some people would argue that the experience of having different partners or getting to know different partners is what then kind of forms what they know or what they think they want.
Okay.
Which is fine too, I suppose. That's one way of doing it. But I think if you know yourself, then you can at least start that search in a bit more of a kind of in a less scattered way. That would be my thinking, I guess. And I don't know whether that's from a psychiatric perspective or just a just general
fair
perspective, but
I like that answer. Like,
Yeah.
know yourself a bit more. To me, it's almost like work on yourself. Really know
Absolutely.
who
Yeah.
you are, rather than expecting this other person to solve you.
Completely. I think it's probably a better way of answering the question in many ways is like, you you need to be like, yes, you're looking for a partner, but you're going to be someone else's partner.
Exactly.
And if you're not whole in yourself, then what kind of partner are you going to be? You're absolutely right. You're not picking someone to be your mother or be your father in again a psychiatric or psychodynamic sense. Like, work through your stuff. Because that's an individual who has their own hopes, dreams, desires for the future and all that. They're not coming in to fulfill a gap in your in the person that you are. Yeah. I think that's probably a really good way of answering it. Is just like kind of working on yourself and being the best person that you can be for the other person. If you think about it that way, rather than who could be good for me, how can I be good for the other person?
Yeah.
I think
that's a good way of seeing it.
You will find someone, like, absolutely.
If today was your last day on Earth, how would you spend it? What would be the places you would go, people you would see?
Man, jeez.
If you were going to walk outside today, knock on wood, God forbid, but you passed, today was your last day, at the end of the day, midnight, what would you do?
I'd live stream the day. I'd live stream the day.
Get as much clout as possible.
Because it would be a hell of a journey. Wow, 24 hours?
Yeah.
I'm just thinking about the practicalities, man.
Yeah.
How do I get to my family? Because initially that's where your thoughts go, right? Jeez. I'd meet them somewhere. You'd have to.
Yeah.
I'd have to be with my family. I'd take my wife with me, and if anybody else can make it out, like, that I know, like, I'll put out, I'd just spend it with people that I love. 100%, man. That would be it. Where? Great question. Because we'd have to find somewhere fairly... Halfway. Where would that be?
Probably Dubai.
Or maybe like go back to the roots, man. Like, make it a full circle moment. Go back to Pakistan. Because I guess my nanny's there and stuff. Like, got family there. Might be a nice place to go. Where I started.
I love it.
Where I was born.
That's beautiful. Hamza.
Yep.
Thank you so much, mate.
Mate, you're welcome. It's been a pleasure.
It's funny, man, because, like, obviously we know each other and we're good mates.
Yeah.
But, like, I feel like I got to know you in a different way and a bit better. Like, even though a lot of the things we spoke about, we've already sort of spoken about. I think, I don't know, like, it was a nice experience for me.
It was a reflective experience for me too, man. Seriously, like, some of the stuff that we talked about, I was like, I think actually, I probably maybe had the thoughts maybe, but like actually speaking them makes a huge difference. Like, actually speaking the words. No, it was good, man. Really cool experience.
Thank you, bro. Thank
you.
It
was awesome, man.
It was a nice to share that with you. This, like, the first one.
Yeah, that's good. I'm hoping that